Good evening, everybody. Little bit late to start today's session because of some work. So we'll start with today's session. So dear friends, we're discussing regarding the mental diseases since a long time and certain aspects about the mental diseases he explained over there. To start with, he explained that mental diseases are nothing but the same part as a corporeal disease. The way you treat the corporeal disease, in the similar manner, you have to treat the mental diseases. Because when you take into consideration any corporeal disease, we used to take into consideration the state of disposition and mind. In the similar manner, while dealing with the mental disease, the state of disposition and mind, along with the corporeal symptoms, both are necessary. But according to the Hahnemann, this is very important to differentiate the mental diseases, so our approach becomes very fixed. So he classified mental diseases into four types, out of which first we have discussed in detail along with cases, that is the corporeal symptoms disappears and the mental disease arises. And this is the, in fact, most difficult disorder, one-sided disorder of a mind. Many mental pathologies like obsessive compulsive neurosis, paranoid schizophrenia, deep depression, anxiety neurosis, like disorders which generally develops in this, comes under the sphere of this first variety of mental diseases. And where he has explained that according to Hahnemann, at that time, the miasmatic focus was Sora. He said anti-soric remedy is the only treatment done for them. Today's modern era, we have to consider it varies from miasm to miasm. It might be any other miasm or mixed miasmatic type, but according to him, it is the anti-miasmatic remedy is the only line of treatment to tackle those disorders. The second variety, which we have discussed, that which is an acute explosion of the latent sora in the form of acute mania due to some exciting cause like sudden fright, quarrels, disputes, or something like that, and because of which the patient goes into the acute manic states, where he explains that to tackle that acute state remedy, non-antisoric remedy, acute remedy, which you have to find it out, and immediately after acute remedy worked, immediately it should be followed with antisoric remedy to tackle the disease completely over there. He explained the importance of that, along with one should follow the diet and regimen so that there will be no recurrence of it. In yesterday's lecture, we have learned about the third type of mental diseases where one is confused because it is, or if it might be early stage of the first type of mental disease, or it might be a second variety of mental disease. You are not damn sure which type of it is there. And then Hahnemann says how to recognize that. You just give the psychotherapy, the reassurance, consolating words, all those things. When you try to put and work for the patient, the thing happens like that, that those symptoms, those, if it is of a second variety of mental disease, patient definitely feels better with such kind words. But if he is from the first variety, these words, these kind words, this consolation, this sympathy aggravates the patient's complaint. So you can differentiate on the basis of this test, and if it is first variety, how to manage that, you know. If it is second variety, you must know how to tackle, and that accordingly you have to approach with those, with such a variety. And that is the confused state of between first and two is the third one. And now he turns to explain the fourth variety of mental disease. Today we'll start with the aphorism number 225, where he explains the fourth type of mental disease, exactly opposite to the first variety. And this is what we have to understand clearly. Aphorism 225. There are, however, as has just been stated, certainly a few emotional diseases which have not merely been developed into that form out of corporeal diseases, but which in an inverse manner, that is opposite manner, the body being but slightly indisposed, originate and are kept up by emotional causes such as continued anxiety, worry, vexation, wrongs, and the frequent occurrence of the great fear and fright. These kind of emotional diseases in time destroys the corporeal health, often to a great degree. So now he explains the fourth variety, where the state is exactly opposite to the first one. In the first one, we have discussed that if you treat the corporeal disease, the physical disease by local means or by allopathic measures, and disease temporarily feels palliated and gets suppressed and then turned toward the mental plane. That is the first variety which we have discussed. Here he explains that exactly opposite thing happens because of long-standing anxiety, because of some grief, because of continued stress on the mind. These persons suffers from corporeal disorder, where the disease expresses at the physical level. Many patients suffering from the hypertension due to the continued anxiety is the best example. Stress diabetes, the tension itself is responsible to produce the diabetes. Very common example. There are many more diseases which are reflections of the mental stress and strain. That's why they are labeled by the name of psychosomatic disorder. The fourth condition is nothing but the psychosomatic. Many a times it has been considered that psoriasis, lichen planus, the skin disorders, but originally they are called to be a psychosomatic disorder. They get aggravated whenever the anxiety increases, the psoriatic eruption increases. Whenever anxiety increases, the lichen planus increases because they are psychosomatic in their origin. And that's why such a variety is again a variety, fourth type of mental disease, and how to tackle, how to approach with those cases. That he explains in the next aphorism. So continued anxiety, worry, vexation म्हणजे मनस्ताप, संताप, wrongs means someone have wrongly troubled or someone who feels that he has been wrongly suffered. That is the wrong. And frequent occurrence of fear and fright. So this might be a many times a reason. Person who is very frightful regarding very small things and trifles, and person suffers from hypertension, person suffers from vertigo, person suffers from severe acid peptic trouble, and such types of corporeal symptoms which appears because of long continued anxiety, long continued fear, and this reflection is called as the fourth variety of mental disease, called to be a psychosomatic disorder. And how to go ahead with this, the he explains it in 226 aphorisms. So we'll learn what exactly he wants to explain about it. Aphorism 226. It is only such emotional diseases as these which were first engendered. Engendered म्हणजे एखाद्या गोष्टीला कारणीभूत होणं. Engendered. Which were first engendered and subsequently kept up by the mind itself. That while they are yet recent and before they have made very great inroads. Inroads म्हणजे हल्ला. Kept up by mind itself, that while they are yet recent and before they have made very great inroads on the corporeal state, may, by means of psychical remedies, such as display of confidence, that is number one, with what you can do in the psychotherapy, he is explaining. First point which he explains is display of confidence. Number two is friendly exhortations. So friendly relationship with the patient and giving him a good advice. That is number two. Number three, sensible advice. So which is related according to his disease, which is related with his disease and properly he is advised. And often by number four, well disguised deception. Well disguised deception means sometimes you have to talk little bit uh, false things even to the patient, some for in order to tackle the some problems. I will give examples of each and every variety of these. Be rapidly changed into the healthy state of the mind and with appropriate diet and regimen, seemingly into the healthy state of the body also. So how to tackle those disorders? He explains the first important thing in such types of disorders is the psychotherapy. And in the psychotherapy, he gives four varieties. The first variety which he explains is display of confidence. In fact, this is the most important thing the patient observes in you. The way you present with the patient is matters a lot. In fact, he is the best examiner in your life. The exams which are conducted by examiners in the college are not at all important. The vivas are not important. But the patient who takes your viva is very important because he observes you. He observes how much confidence this fellow has, how much confidently he talks, whether the physician who is treating me, he is having knowledge or not. All those things, every patient judges. In modern era, patients are more intelligent than us because they comes from Google Doctor. They comes to you by reading many things about their diseases in on the Google, and then they comes and they talks a lot. They says that I know each and everything. What else you are telling that is more important. They always observe the confidence in you and the way you present. Yes, you damn confidently says yes. No, don't worry. I will going to cure you definitely. That is more important for patient. It is very important. Your kind words are very important for. And he always observes the confidence in you, how much confident you are in treating such disorder. And that's what he explains over there. The first important thing, the display of confidence. To this, what he explains, this is called a psychical remedy. What he has utilized the word, this is psychical remedy. Psychical remedy means psychotherapy. This is the remedy. The way you behave is the remedy for the patient. Many times it happens. There was one patient who I have explained his case in on blog, and even I think I have talked to you about him. Valya becomes Valmiki, that the blog written by me, and it was way back I have treated that. What he used to tell me many a times, he was a case of cardiophobia, and after proper treatment he recovered. But he one day he told me something, and I was just laughed and enjoyed what he said. What happened? He explained to me, doctor, many a times I come to your OPD. I start from my house, and when I come to your OPD, I just see your face from the outside. And after looking towards me, I feel, yes, now I don't want to show you. I felt good. And I ran away from your clinic. This happens many times. He says that that's all. That is sufficient for me. What it means? It means you act unconditionally in the patients. Your medicine acts conditionally, but your presence acts unconditionally. And that's why the confidence in you is very important matter which treats your patient. And that's why your personality, your behavior, your talk, your presence, your confidence about the disorders, your knowledge, everything gets expressed, and that matters a lot. And then patient is quite confident, yes, this fellow is going to treat me. That's all. The axis is changed. The axis is changed from the disease to the healthy state, and patient starts improving. This is the first important thing which he explained over there, the display of confidence. Number two, the friendly exhortations. Yes. When you deal homeopathically, this is the most important criteria which you have to develop. Don't consider patient as a someone different, but make him your friend. That much attachment you have to develop. So how will you develop that? It is nothing but the communication skill. The tone of your voice matters a lot. The tone is responsible to attach the next person who is sitting in front of you. The way you put your questions is very important. The sympathy tone should be there in your communication, which gets a very close relationship with the patient. And then patient opens up. There are many, many more things. You must make a whole environment friendly. And this happens when you make small jokes. You comment on something either on patient, either on you, yourself. A small compliment to the patient makes him comfortable. You just talk, looking toward the patient, you just talk with the present situation happening around you, and you find, yes, this fellow is from the same area. You talk something, and patient becomes absolutely open. This happens many a times. You have to discuss all those things which are necessary, because this is the communication skill. Whoever the next person is, whether the person is very small child, whether the person is the youngster, the person is adult, person is old, whoever it may be, you should develop a good communication with them as if he is your friend. And this you have to develop, this technique you have to develop. This matters a lot in your practice. In fact, it is the only thing which matters a lot, which gives you lot of patience, which gives you your patient a confidence about you. And then patient never hides anything. Because if patient hides something, we never get a proper data. And if we don't get a proper data, it is not possible to get the results. In order to get the proper data from the patient, what is needed is the friendly exhortations. And this is second quality, which he has explained very nicely over there. This you have to develop. The third important thing in the psychotherapy, what he explains over there, is a sensible advice. The word which has used is very important, the sensible. What is sensible? Sensible is nothing but according to the situation, from what disease he is suffering from. You have to understand that first. And then, according to it, you have to utilize your knowledge. According to it, you have to give a proper advice to them. It should not be fixed for everyone. This is the advice. No. According to each and every case, the advice changes. It varies from individual to individual. And that's why the word which has used is very important. Sensible advice. So it is related with the situation. What situation the patient presents, along with that situation, he expresses. That is very important thing which he is explaining over there. A sensible advice. So a patient who is suffering from the psoriasis and he comes to you and he seeks homeopathic treatment, what you are going to advise? There are many people who explains to the patient, yes, you will be cured completely. If you say such a thing, you are wrong at the first sentence. You should not use this word when you are treating the psoriasis. It is so difficult disorder. Yes, you must tell him that this disease has a waxing and waning. It increases during the winter. It ameliorates during the summer and rainy season. And when you are going to start the treatment, there will be waxing and waning, and then it gradually cures. But it takes a long, long, long period. It is not within a year or two the psoriasis get cured, but you have to continue treatment for longer time of duration. If you are ready, then you continue. If a patient comes in exactly at the start of winter, then you have to explain to the patient that your psoriasis will going to increase when you start the treatment, because it is the time of increasing. It is not because of homeopathic medicine your disease is increasing now. Your disease will going to increase because it is the time of winter where there is aggravation. So sensible advice. This is too important. Don't tell lie to the patient. There are many people I have seen that they lie to the patient. You should not tell them, yes, this will cure immediately. Not at all. Many skin disorders which are psychosomatic in condition, it takes long time. The eczema, the lichen planus, psoriasis, but out of which psoriasis takes a very long period to get cured. And this is what he wants to explain over there. Your advice should be sensible according to the situation. You must tell them, yes, I will try my level best to cure, but don't tell that I will going to cure you 100% immediately. Not at all. It takes a long period. If you are treating any cancer which is developed because of some long continued grief, tell them, yes, I will try my level best to treat you, but it will not happen within a day. It's a long time which you have to pass. So sensible advice is the third important point in the psychotherapy. And fourth point, which he has mentioned, is very important. Well disguised deception. Many people never understand this. कपट कारस्थान करणं पेशंटच्या सोबत. How to do that? Here, if many times in our homeopathy, we get patients from whole family. And their disorders, we know they are because of disputes between them. Generally, the disputes between mother-in-law and daughter-in-law, that is, those are very common disputes in Indian families. And if both of them are your patients, you are the best. If you tell them properly, you are the best doctor, best homeopathic physician. Here, Hahnemann's talent comes into play. If the mother-in-law comes and she starts complaining about the daughter-in-law, tell them, you are telling me like this, but she was actually praising you on that day. She told very nice things about you, all things. And tell them that even though she has not uttered a single word, but you tell them, yes, she has talked so nicely about you. The same thing happens when daughter-in-law comes and she starts complaining about the mother-in-law. You tell them, yes, you are telling me this, but your mother-in-law was telling very good words about you. She asked what she said. You tell, yes, she said you are very nice daughter-in-law. Everyone should get daughter-in-law like this, all those things. Make such a thing. It is good time. What will happen? The disease will disappear without a medicine. This is what he says. This well disguised deception. These are many times works. Such things you have to do. Such magics you have to utilize. And this is what he explains over there. A well disguised deception be rapidly changed into a healthy state of mind and with appropriate diet and regimen. Very important thing which he has mentioned. He has not mentioned these are only things. The one more addition is that well-maintained diet and regimen. Daily routine you have to ask the patient to follow. If patient is sleeping late at night, it is your duty to tell him if you want to get better, you have to sleep before 11 o'clock. Tell them exactly that, yes, you must go to sleep at 10:30. Switch off your mobile either or make it silent and just open it in the morning. Go to sleep and just observe what happens. When he gets a good sleep, he settles. And these are very important things in the practice. So ask him regarding proper diet. But you must know what is proper diet. This is again a question. Patient asks many questions. When you talk about the diet, patient asks you many questions. You must know each and everything regarding the diet. You tell them how to maintain the diet. If the patient wants to reduce the weight, then you must tell them how to go ahead. Then tell them exactly the formulas, how it works. So everything regarding the diet matters a lot. And if it has been a support along with the psychotherapy, along with the diet and regimen, then your remedy works wonderfully. And these are most essential things in such types of fourth variety of mental diseases. So we'll stop over there. We'll take break over there, and tomorrow we'll continue with the next further one more aphorism or two more aphorisms. In fact, remaining aphorisms, at least 2 to 28, is very important, where he has mentioned mental regimen. But I think tomorrow we'll take only 227 and we'll stop, and we'll keep this mental regimen after the summer holidays. There will be summer holidays right from 21st onwards. I will not be there till the 1st or 2nd. So you'll have a big gap. So everyone keep it in your mind. Tomorrow's session is the last session of this summer. There will be holidays, and then on the 2nd or 3rd May, we'll start with the sessions again. So tomorrow we'll finish only one aphorism and we'll stop. So thank you being there, everyone. And
Thank you, sir.
if any queries are there, we'll have chat. Otherwise, we'll conclude.
Sir,
Hmm?
sir, the
Good.
rubric cough incessant and cough paroxysmal long. What is the difference, sir?
I could not understand your question. Just repeat it again.
The rubric, sir, in cough chapter,
Hmm?
cough incessant and
Cough.
cough paroxysmal long.
First rubric is cough in
Incessant.
okay. And
Cough paroxysms long.
what is paroxysms long? First, we'll discuss about paroxysm long. Once a
Okay.
paroxysm comes, it never stops immediately. If a patient starts coughing, the whole spell, it takes 10 minutes, 15 minutes, and then it stops. That is the cough paroxysm lasts long. In cough incessant means it happens very easily. It comes out very easily, but it never persistent. It comes down. Again he has, again there will be attack. It is not a constant which is there, which happens to be there in the cough paroxysm lasts longer. So there is little bit difference, but one where the acute exacerbations are again and again happens over there. It is intermittent, but in case of second rubric, it persists for a longer time of duration. Many times patient complains, there, doctor, once I start getting the cough, it never stops for 10 minutes, 15 minutes. I goes on coughing, coughing, coughing. That is a paroxysm lasting for longer time of duration. Okay.
Thank you, sir.
So we'll stop and we'll meet tomorrow evening. Thank you.